If you have any questions, if you could kindly wait till the ending of her presentation or ask the questions in the chat. Thank you. Jill, you want to take it away?
Hi, does everyone hear me okay?
Yes.
Great, thank you for joining us for our third presentation in a series of lunch and learns that we've developed specifically to help people better understand their health insurance documents and be able to use these documents to maximize your benefits. The series is continuing through the summer, and thus far we have given presentations on insurance terminology and the importance of maintaining and using your benefits book. Next month, we're going to be discussing adverse determinations made by health insurance. In other words, non-coverage decisions and your rights to appeal those types of denials. So join us on Tuesday, August 23rd for that topic and our next Lunch and Learn. Today, we're going to discuss the explanation of benefits documents. So the explanation of benefits, or the EOB, is a document that your health plan prepares and sends to you for the sole purpose of ensuring that there is transparency when we use our health benefits. So this presentation is going to be a general overview of why the EOB is important. And I have some example EOBs to share that will help show the common elements found on EOBs. So why do we need to know, or what do we need to know about EOBs? Again, they give you a general overview of the health care services we have used in a statement period. And typically statement periods are monthly. So in the very simplest of an example, take a look at the EOB on the screen. At the top, you're going to see your name, or a name, claim number, the date the claim was received and processed, the type of services, and the provider's name. Now, below that general information, you'll see accounting details. But the first thing you might notice when you open an EOB is the sentence, "This is not a bill." And too often people see, "This is not a bill," and then they don't give the EOB much further consideration. But EOBs are very important, and they should be reviewed, because the EOB is giving you notice that your health plan has received one or more insurance claims, and it details your health carrier's coverage decision about your benefits. So this list shows the common elements on an EOB. And I've circled some on the bottom that I'm going to be zeroing in on today to help you better read and understand your EOB. And those elements are the billed amounts or the charges. These are what are reported by the provider on the insurance claim. Then we're going to break it down into the actions that your health plan took when they received the insurance claim. So EOBs will show what decisions they made about your benefits, specifically what they paid, what they didn't pay, and most importantly, the reasons why. Now, here's a very colorful graphic to illustrate how these common elements might look on an EOB. So reading right to left, you're going to see the date of service, the provider's name, the claim number, and then you see the accounting, how much the provider charged, how much, and then they've listed here something different. It's called network savings. We'll come back to that. And then how much the provider paid. And then the other accounting is the amount you might be responsible for. But EOBs also contain other information. And EOBs are rarely as clear and easy to read as this example. EOBs tend to look more like this. And as you can see, they are jam-packed with information. So how do you read an EOB? Well, first of all EOBs are not alike. The style of the explanation of benefits vary from insurance carrier to insurance carrier. So once you've become familiar with the format your insurance carrier uses, it'll become easier to read your EOBs, and they become easier to understand and easier to use to maximize the health benefits that are available to you. So to get to that point, here are some important terms to understand when reading EOBs. Okay, so there's a billed amount and a maximum allowed amount. There are also deductibles, co-pays, and co-insurance. And these are what gets paid out of pocket. Then there's a term called a discounted amount. This is the difference between the billed amount and the allowed amount. EOBs also reference patient liability, which is the total out-of-pocket cost. EOBs also will show any not covered services. And most importantly, there are remarks and claims processing codes on explanation of benefits. Now, whenever you hear me say today that, I'm sorry, I'm going to back up. Whenever I say the word service today, I'm using that word very generically. Services would include any type of treatment, procedure, service, equipment, or supply that might be listed on an insurance claim. All right, so this first word is the maximum allowed amount, or the MAA. Let's understand this better, because most healthcare services have predetermined or customary reimbursement rates established for the types of services we use. And that's what's referred to as the maximum allowed amount. One of the columns on your EOB will include the allowed amount, but there are other words often seen. The maximum allowed amount might be called an approved amount, a contracted amount, negotiated an amount, or the total amount eligible for benefits. So that's allowed amount. But then the EOB will show you the charges or the billed amount. So again, this is the amount that the provider submitted on the insurance claim. And what's interesting here is that you will see that the charged amount is usually higher than the maximum allowed amount. So when you begin to compare charges versus allowed amounts, it's very helpful to know if that particular provider is an in-network provider or an out-of-network provider. And here's why. In-network providers will accept the allowed amount as payment in full, but your out-of-network providers can charge you the difference between the billed amounts and the allowed amounts. And that's referred to as balanced billing. So in other words, there might be more out-of-pocket costs when you use out-of-network benefits. Which brings me to the next term we see on EOBs, and that's discounts. If your EOB shows a discount column, this refers to the difference between the billed amounts and the allowed amounts. Discounts on EOBs might be referred to as a network discount, a member savings, or a fee adjustment. So here are some examples of how it would look on an EOB. The differences between, as you see here, and we're only looking at these three colored block columns. So you have a provider amount, an allowed amount, and the member savings. So this EOB represents an insurance claim for a visit to see Dr. Smith. Okay. Dr. Smith for these services charged $1,075. The allowed amount was $700 for a difference of $325. And that's why this is listed as a member savings. So if Dr. Smith was an in-network provider, this $325 would technically be a savings. But if Dr. Smith is an out-of-network provider, he's allowed to bill above the amount that exceeds the allowed amount. And so this is an example of why it can cost more to use out-of-network providers. Everybody with me okay?
Yep.
Here's an example of an EOB that shows you some of the additional accounting details that's found on an EOB. So reading right to left on here, you're going to see a date of service, description of the service and the claim status, then the provider charges, the network discount, co-pays, deductibles, co-insurance, finally, the amount paid by the insurer and the amount you owe. But the last column is just listed as comments. So let's look at 4 actual EOBs to become familiar with where you find these common elements on an EOB. This first EOB represents an insurance claim from a trip to the dentist. So reading right to left for the columns shown, you see a date of service, procedure code, and a description of those services. But then the accounting begins. First is that $205 was submitted as charges for this claim. Then there is a fee adjustment column, and they've listed $30 there. So the difference is the approved amount. The approved amount here is $175. And as you can see, Delta Dental Plan on this claim paid $175, which means they paid the entire allowed amount. So if this were an in-network dentist, you wouldn't expect to get a bill. The next example shows an insurance claim where there is out-of-pocket expenses, and you should expect to receive a bill. So again, reading right to left, but I'm only going to read these total lines. The submitted charges were $360. The allowed amount was less, $276.76. The next column shows that there was a $20 copay. You can see this red arrow that I added for emphasis. Now the next column, when you come to the deductible column, you'll see that no deductibles applied to this claim. The next red arrow shows that co-insurance did apply. So co-insurance in the amount of $1,667 is going to be paid out of pocket. So what you would expect to see under this column here, it says patient responsibility, might be just the copay and just the co-insurance. But if you look here, it shows more than $36.67. It shows $126.67. So in other words, this is an example where a portion of an insurance claim was not paid. So this EOB has 2 columns. One is not payable, and the other says see remarks. And I'm showing you these up here with the red arrow. Here you'll see that $90 was listed as not payable, even though it says $90 might have been eligible or allowed. So the only way in this EOB you're going to find out why wasn't $90 paid is to then look for the remark. It's listed as code number 1, and then you go to your remark section, read that code, and see what it says. The next EOB will show you the remark section. But it's also an example where your health insurance didn't pay anything on the claim. As I walk you through this one, we're going to find that there are 2 separate reasons for nothing being paid on this claim. One of the reasons has to do with the way your health plan is designed, meaning the co-pays, the co-insurance, or deductible responsibilities. But the other is a non-payment decision made by the health plan, which is a denial of coverage. So here we see that this Dr. Smith submitted a claim for 3 things: medical care, laboratory services, and supplies. So working right to left, the provider billed $875 for the medical care. $600 is allowed. So their member savings is listed as the difference. So, but the plan paid 0, as you see in what your plan paid. Now, to know why, you have to look at the other accounting, and you see right here that the $600 that was allowed went to your deductible. Similarly, for the lab results, lab tests, $150 was billed, $100 is allowed, and once again, your plan paid nothing. Why? You can move through here and see that $100, in other words, the entire allowed amount, went towards your deductible. But we see something very different when it comes to the supplies line item. Here the doctor billed $50 and the allowed amount is 0. So you wonder why. Obviously they paid 0. So now you have to go to your remark section, and here the remark, the reason code is ENB. You head down to your remark section and you'll see that ENB is a code which means claim denied. Service is not covered for either the primary diagnosis or the service code. But there's additional information here. It also says that the claim would be reprocessed upon receipt of additional information, and it says within 1 year. So what this is telling you is the reason it denied, but it's also suggesting that this denial might be resolved by some type of administrative action, most likely action your doctor would have to take. In the last EOB example I'm showing is simply to demonstrate that EOB styles can vary. So, and it's important to become familiar with the format that your health plan uses. The services listed on this, you can see in the first column, an office visit with labs drawn and an x-ray. And then there's something listed as surgery. Okay. As you can see from the billed amounts, next you'll see the date of service. Next you'll see the charges from the provider. There's some adjustments suggesting this might be an in-network provider. But column number 5 is quite different. On this style EOB, they have lumped together any applicable co-pays any deductibles, and any not covered services are all in one column. So in this EOB, you see there was a $15 copay plus $50, and it was for the labs test, went to your deductible. But then they've listed $50 with a code that you need to refer to the bottom to understand. That code is 575. And when you look at the remarks, it says this procedure is considered cosmetic and your plan does not cover cosmetic services. So I hope these examples help you see that there's lots of information on an EOB and that the chart reflects the actions that your provider took, your insurance carrier took, and the description and the reasons are going to be found in a separate section. But I have an additional slide where I want to just talk about the remark section and specifically non-payment codes, because there are literally hundreds of reasons where an insurance claim might get rejected or denied. And these tend to be either for administrative reasons, coding problems, or they're denials based on the health plan having determined something isn't medically necessary for you. But they also can be a combination of all three. So here's some examples of the descriptions about and that we would see on some non-payment codes. What's important to note here is that each non-payment decision will be coded and it will be described on the EOB. Secondly, the type of denial, in other words, the reason for non-payment, that is what determines if appealing the decision will be allowed. So again, join us next month, but when we talk about denials and our rights to appeal. In the meantime, anytime a billed service is denied on your EOB, check the remarks section to learn out the reason why. The remark sections might show you that steps could be taken to resolve the problem outside of the appeals process. Now, there's one final area of an explanation of benefits that I haven't addressed yet, and it's important. It is the date of the statement. See here, I've circled the date on this EOB. The statement date is important because the EOB statement date is considered the official notice date. In other words, you've been notified. In timeframes in which you're allowed to dispute non-coverage decisions begin on the date that you're notified. Not to be confused with dates of service. It's the date you're notified. I hope that's clear to folks. Timing to dispute things is so important that when you're reviewing your EOBs, it's very important to remember that very strict time limits to dispute non-coverage decisions most likely apply. All right, the time frames that you're allowed would be specified in your benefits book. So, but just start by knowing, or if you learn about a non-coverage decision from your EOB, it's the EOB date that starts that clock. Very important thing to realize. So I hope this presentation has helped you to better understand where to find information on your EOBs. And as you've seen, EOBs contain a lot of details about the healthcare services you have used. And they are also official notice by the health plan if they've rejected or denied an insurance claim. So I'm going to close today with making 4 recommendations. The first is that it's a good idea to compare your EOB side by side with the corresponding medical bill. You're looking to see if they're balanced, and you're looking for non-coverage decisions. Then, if something is wrong with the EOB, act quickly because of the time limits that I've been speaking about. And it's also a very good idea to keep copies of your EOBs and your medical bills. Keep copies of them all and keep them together so you have them if you need them. All right, so the last thing I'd like to say is, what do you do if something goes wrong on an insurance claim or your EOB? When problems or discrepancies come up on your EOBs, you will most likely need to take it up with both the doctor's office and the health plan. If those 2 steps don't resolve the issue, or you believe you've been given incorrect information and you need help, call the Office of the Healthcare Advocate. OHA's services are free. We offer expert assistance and representation on all types of health insurance questions and problems. And we're very easy to reach. Either give us a call or reach out by email. We are standing by, ready to help. So that concludes a general overview of the explanation of benefits. We would love to hear your feedback any way you choose to give it. And by all means, if there is a health insurance topic that you want to learn more about, please let us know. All right, I'm going to turn things back over to Denise, and we will take your questions.
Hi, are there any questions? You can ask it in the chat. And I've also provided the same contact information that Jill has up on the screen in our chat as well, if you choose to email us or call us with your questions.
Any questions about today's presentation on EOBs, or wondering about next month's presentation on denials and our appeal rights?
So I can raise my hand.
Hi there.
Hi, thank you so much for a very nice presentation. So one of the things about the appeals process that I have some concerns about is when it's a Medicare Advantage program, it may not be quite the same process in terms of, say there's a question about whether or not a service is required medically, and you have a question with your provider, because it may not necessarily get denied or processed. So it just becomes kind of a question between you and your provider. And I just wondered, this is something that I would always refer to your office, but I didn't know if you had any other information to provide.
If the denial stems from a disagreement between the patient and the provider,
Yeah.
it certainly should be explored to make sure that the disagreement doesn't stem from administrative mistakes or any of those coding types of problems. Now, but if it's a matter of the doctor's office doctor is stating that they don't believe something is medically necessary, then we always still have the right to appeal. But it really needs to be looked in closely, because you definitely want the provider that's recommending services and the patient to both be able to state that these are necessary and give all of the clinical details why.
Well, thank you for that. And I have had constituents contact me regarding the fact that the doctor submitted a procedural code error, and then that ran into difficulties. And correcting it, sometimes not even just getting the entire amount of information submitted. Can be
Those
upsetting.
we receive calls like that all the time. We
Mhm.
can sometimes work it out quickly over the phone, or we actually open a case and offer direct assistance. So keep referring them to us.
I do, and I do appreciate all your work, and you've helped lots of my constituents. So thank you
Well,
so much.
I appreciate the question, and I just want to thank everyone for coming today. Come and join us again next August 23rd. Is that right? Yeah,
Second.
August 23rd, and learn more about the appeals process.
Yes.
Well,
Yes.
everyone have a good day.
All right. Thank you, everyone.
Bye-bye.
Bye.
Bye, Denise.
Bye.